Hey, good morning, everyone, and thank you for joining the August meeting of the Security, Privacy, and Compliance Committee of New York HIMSS. My name is Mark Ferrari. I'm the co-chair of the committee, and this morning I'm happy to introduce a discussion for you that will include a panel discussion that will be moderated by our first guest that I'll introduce, Sean Winter. Sean Winter is Movius Global Vice President of Client Success. Sean's a thought leader and industry thinker when it comes to making the lives of customers easier, more efficient, and successful. Sean, as you can see from his background, enjoys all types of music, and like me, enjoys a craft brew in his downtime. And Sean, you'll take it from here and introduce the rest of the panel. And again, thank you all for attending, and thank you to our presenters for contributing.
Yeah, thank you, Mark. I appreciate that. Good morning, everyone. As Mark said, Sean Winter, avid musician, craft beer drinker, probably a little too much during this pandemic. But I'm coming to you live from Richmond, Virginia, as the clouds behind me start to come in as we brace for what could be an interesting night. Hopefully not too interesting from a storm perspective. But I'm thrilled to be here to have this conversation, and I'm joined by two panelists. Who I'll introduce in a few minutes, but I did, before we get started, just wanted to give a little background on the topic and context for today, if that's all right. And if we could jump to the next slide, that would be great. Wonderful. So I think we're all probably getting a little sick of the new normal type of terms, but I think we are in a new world of work. For the first few months of this pandemic, it seemed like everyone was very eager to get back to the way things were. And now I think we're realizing that there are probably a whole lot of permanent changes that are hitting a lot of industries right now, whether driven by, people not being able to get to the office or the massive changes in the economy and whatnot. So there are four points here that we wanted to make specific to how the pandemic has accelerated digital transformation. The first one being a work from anywhere world. Companies are obviously being really aggressive in work from home programs. I think Google and a few others just recently announced that their employees will be home through July of next year, so throughout the school year. And that's something we're certainly seeing more and more of, which is really changing and forcing a reevaluation of the need for office-based work in a lot of industries. Accelerating the digitization of communications is another one. Customers are becoming increasingly specific with the types of channels and technology that they like to use to communicate. And I think as customers get more comfortable with things like WhatsApp, Zoom, etc., they're not just using them for their families, but they're expecting to use them as they talk to providers, as they talk to clients, you name it. The third one there is specific to mobile, gaining momentum. Obviously, companies are charged to very quickly figure out this mobile world and in a secure and compliant way. We've worked with call centers that have had to be relocated in a matter of hours because of the pandemic. So massive changes there in terms of bringing mobile communications that are secure and compliant to users' homes. And then finally, the bad news here is as we watch Q2 earnings come out, aside from tech companies, we're seeing some pretty bad earnings. We're seeing obviously a huge effect on the economy. So we expect cost-cutting measures to be really, really top of mind as we go forward, and firms are going to have to do more with less. I remember years back when a lot of companies started removing their stipends for home internet because it was just table stakes. Everybody had internet, and I think we're going to start seeing that with technology, devices, phones, laptops, et cetera, as we move forward as well. Next slide, please. And I promise I'm not going to kill you with slides because we want to get to the conversation here. But I am, as Mark introduced me, I'm from a company called Movius. We're based out of Cupertino, California, and we provide secure and compliant business communications that can live on a personal mobile phone. So the idea that you have your phone, you do all your messaging, your phone calls, your app browsing, etc. We can have a little container on that phone, and it's all done within an app. And it's a service that allows for a separate phone number on a separate network, separate texting that can all be recorded, secure, compliant, etc. And we'll try to kind of weave that in as we have the conversation today. As far as why we're here today, what are some of the topic points? And this will be on the next slide. Obviously, BYOD, this was a huge trend, the concept of bringing your own device to work 10 years ago. And then we saw it, about 5 or so years ago, we saw it fall off a little bit, probably tied to the economy, but also to lack of mandates from companies in terms of figuring this out. And I think our guests today will have some great insights into bring your own device programs. And we expect, of course, with the economy getting much tighter, these programs to play a much larger role in the future. Mobile compliance and secure communications. Obviously, in healthcare, we're in an industry where it's the utmost importance to ensure that communications with clients, patients are compliant, are secure, are recorded when necessary. We work a lot with government and financial services as well, where that's also an issue. So certainly very top of mind. As far as expenses, I can't tell you how many clients of ours have had what we call is this element of sticker shock, where they send everybody home, and a lot of those folks are making international calls on their personal cell phone, and then they go to expense that at the end of the month, and it's an astronomical figure. So certainly something that we want to keep in mind as people are working more from home and they're unable to get to their desk phone. And then patient satisfaction. Obviously, we mentioned earlier the notion that clients and patients are more comfortable than ever using consumer technology, using things like WhatsApp, text messaging, et cetera. How is healthcare adapting? How are they providing those channels for their patients moving forward? So on that note, if we could jump to the next slide, I'd love to introduce briefly our two panelists. And Kevin and Paul, after I introduce, if you guys could maybe give a deeper introduction. We have plenty of time today, so take your time. We'd love to learn more about you before we kick off the conversation. So I'll start with Kevin Rinn, who is on the left for me. I don't know if he's on the left for everybody else, but he is Director of IT from Lighthouse Youth Services. Kevin, you mind giving us a quick introduction? Kevin, I think you may still be on mute. There we go.
There we go.
Perfect. Welcome.
Thank you. Nice to meet everybody. I am an IT director at a nonprofit for poor children called Lighthouse Youth and Family Services. I've been here 2 years. Before this, I worked at another company called Children's Home of Cincinnati, which had the same mission, and I was there for 15 years. So I've been in the industry for a long time. They're all HIPAA, both organizations are covered under HIPAA, as well as PCI and many other alphabet soup regulations. And so I'm very familiar with a lot of the mobile options out there, and we eventually came to this Mobile Connect solution, and we're very happy with it. But glad to answer any questions about the HIPAA related information or anything about how we used the software or app.
Wonderful. Thank you, Kevin.
Thank you.
And Paul Schmidt, who is a relationship specialist from the Counseling Source. Paul, welcome.
Good morning.
Would you give us a little background on yourself, sir?
Sure. My name is Paul Schmidt, and I've been with the Counseling Source now for about 6 years. Our agency, we are a for-profit mental health agency located in Southwest Ohio, but we serve populations throughout the state of Ohio, primarily adults in long-term care, students in the school settings, as well as about 8 workshops for the developmentally disabled. And I too am happy to answer questions and would love to really delve into this discussion with mobile communications. It was kind of a secondary role that I took on when I first entered the Counseling Source. I had kind of a basic knowledge of cell phone technology and could work to get things set up for our clinicians and get things sent out so that they could do what they need to do remotely. And it's just kind of taken on a life of its own, and doing it now in a way that we hadn't quite envisioned in the past. is something new for us all, and we're learning. So.
Yeah, absolutely. I think it's trial by fire pretty much everywhere these days, especially
Definitely.
in healthcare for a variety of reasons. So Paul, let's stay with you to get this started. How important would you say is mobile communications to your organization? What are the needs from your clinicians that you need to meet these days that maybe are a little different than they were 6 months ago?
Well, I'll tell you, in the past, I would say pre-COVID-19, it was primarily an internal need for our folks for the purpose of reaching us reaching them, for getting email downloaded on the fly. When you have an urgent referral, you need to know about it and be able to respond in an appropriate time frame. And prior to that, I would say our school-based clinicians also were the primary users of cell phone technology in an effort to reach parents for resolving referrals, doing follow-ups with the parents about the child, but it was primarily an internal device. Post-COVID, everything changed, and we found ourselves not being able to access our adult clients in long-term care as well as our student population. And so that was a time when we really had to pull out all the stops. We were thankful that the governor had loosened restrictions with regard to telehealth, and that has been the main thrust since March of how we're doing what we do. And so having laptops being sent into nursing homes, flip phones that we had to order, anything we can get our hands on to try to make communication with our clientele. And it's just been so key. So this was also a good time and opportunity for us, and I'm sure this will come up later in the conversation. This was a good time for us to move forward with the MultiLine, the Movius MultiLine app. That was something we explored a little over a year ago, but kind of dragged our feet on it, and we had some resistance and pushback from some of our folks who were very much attached to their hard devices. And this just
devices
like
that you provided them, I assume.
Devices that we provided them, yes. So this was a good time and a good opportunity to, I think, make that change amidst all the other changes that were being thrust upon us anyway. So.
Yeah, no, that's a good point. Kevin, what about you? How important is mobile communication to your employees, your clinicians, your clientele?
It's critical. We do something similar as Counseling Source in that we have behavioral therapists out in the field and also in schools, as well as foster care and adoptions. The critical thing for us really, we were probably 4 years ago when we decided to move towards laptops for all our staff, and most of our staff are in the field, and to get away from providing them agency cell phones at the time. And so we experimented or researched many different products to that would be HIPAA-compliant. And then sorry, go ahead.
Oh no, I think we're just getting a echo
feedback
from somewhere.
So
try now.
Yeah, so we had luckily had made this change before the COVID happened, and telehealth was also driving that. If somebody has any meaningful use physicians, going back now 10 years or so, a lot of this was, I want to say, predicted. You were getting reimbursed if you could do some of these things. So luckily, when the COVID happened, it was very little, it wasn't a lot of difficulty for us. Very little change had occurred on our part. But it's absolutely critical, and I think to our business, and I think in the future, it's going to be for everybody, which is that work at home, stay 24/7.
No, and that makes sense. And I've heard you both mention telehealth, and I've also heard the term lately a lot, telemedicine. Can any one of you tell me what's the difference between the two, or what are the definitions of those terms?
As far as I think they're the same thing, but
Yeah.
I don't know. Are they?
I would agree.
It
And
used to,
they encompass both video or audio, traditional cell phone or landline, if you will.
Mm-hmm.
In Ohio, it used to be, it was against the law to provide telehealth, or it wasn't permitted, might be a better way to say it, in behavioral health until recently. Even though
Wow.
you could do it in physical health, you couldn't do it in behavioral. So we are pretty far behind on that compared to the physical health side of the house. Do you guys do anything, Paul, with that? Or is it all like, is it Zoom or WebEx, or what do you guys do?
Currently, Zoom is the primary platform that we're using at this point. Although my understanding, at least throughout the pandemic, we've been able to pretty much use any platform available to us. Some obviously are safer than others, and Zoom has gotten better.
Yeah,
but it's the one we're most comfortable with. I'm sorry, go ahead.
Well, same for us. And the MultiLine is researching, I believe, adding the visual side to the house. But eventually, the COVID relaxation will go away, and then
Yes.
we'll have to move to a telehealth app that's HIPAA compliant.
Mm-hmm.
Yeah, understood. And what does that entail, being HIPAA compliant? For a communication app, that is.
So it's got to be secure,
Mm-hmm.
number one. You have to be able to wipe it off of the phone of the staff person, which traditionally, if you were an exchange shop, you could hit a button on exchange that would wipe the whole phone, which means everything, pictures, music, etc. So the MultiLine apps of the world came around to help us protect their phone and also to protect the HIPAA compliant information in one package that could be removed if the person left the organization, but not ruin their phone, so to speak.
Got it. Understood. And so these are all on their own personal devices, is that correct?
Correct.
Yes.
Now, what led you to implementing a bring your own device program? Was it purely cost related? Was it more, employee experience? They're already carrying around a phone, so why should they carry around two? What were some of the factors that you considered to arrive at that decision?
Paul, do you want to answer it since you guys have just decided?
Sure. Well, I would say the decision was multifold. Cost certainly was one of the chief driving factors in it. The convenience of not having to carry two phones was a nice seller for some people. The portability of their existing numbers was huge, and we had great success with that. But the idea that if somebody who lived 4.5 hours away was going to turn in all of their equipment that was issued, phones, of all of the equipment that we issue, the phone was the hardest one to get back. And arguably, it could have had the most, at the time, the most PHI on it, protected health information. So, until you can assure yourself that that's wiped, you really are under a stressful situation there, knowing that you have a phone that could be out there with emails on it or contact information of your clients. So this really afforded us a better solution because, as Kevin was talking about, there's an ability for us to wipe the parts of the phone or clear out the apps that are pertinent to us that we own. So right now we have an email application that's encrypted, that's downloaded onto their phones, but the emails are not. And then we have the MultiLine application, which serves the same function, but it's phone, text, and voicemail.
Now let's talk about that. You mentioned porting of the numbers. Were these desk phones that you were porting onto their personal mobile device?
No, what we did, we looked at our existing cell phone account, and we looked at who was out of contract. And we went to those folks and asked them, hey, do you like this? This is their work cell number, basically. and we asked them, hey, do you like this number? Do you want to keep it? Do you feel that it's still pretty important, or do you care to get a new number? And by and large, 98% of them wanted a new number, or excuse me, wanted to keep their existing number. So we compiled a list and went through the activity of kind of a pre-port process that involved getting some information to Movius so that they could kind of do all of the work on the front end, and it just made the transition virtually seamless. So
that's great to hear.
Yeah.
Kevin, what about you and Lighthouse? How did you all get to the concept of a bring your own device program, and how has it been going so far?
Yeah, we had the same issues, probably because we were very similar in our organizations and what we do. The therapist complained, or the nurse or physician, about having two phones. Mm-hmm. That was probably their biggest complaint. They also always had a personal smartphone. So when we gave them the option of carrying one phone and you get money, you get reimbursed for a big percentage of your home bill that you're going to pay anyway. So they saw it as a win-win. They're getting their phone paid for, and they can carry only one device. And for us, it was ease of use. Instead of giving someone a smartphone, which is very time intensive, or maybe it should be labor intensive for the IT department, we could simply put an app on their phone, and it's very easy to use and very simple to delete when needed. So It really was MultiLine was a great product. We had had the luxury of doing this several years ago, so we could spend a lot of time looking at the various different options out there and testing them out. And we set it on MultiLine as the easiest, and that was really from the behavioral health therapist. It wasn't IT telling them this is the app to use. They evaluated and picked actually MultiLine for us.
Oh, great.
So.
Well, that's good to hear. Did you, Kevin, did you guys port any numbers over from corporate phones or desk phones, or are these all new numbers?
Same thing. They really wanted to port their existing numbers over and their existing contacts. Mm-hmm. As typical therapists may have 70 contacts in there, and have been doing the job for 3 or 4 or 5 years. So there's a lot of legacy there, and it's a pain to port things over, as everybody knows. So if they could get it done by the company, rather than have to type all those contacts in by themselves by hand, they were all for it.
That's great to hear. How has the feedback been on the program so far? Paul, I'll go back to you.
We're about 2 weeks out, and I tend to operate off of the no news is good news premise. So I haven't heard a lot of feedback. We had one person who their company phone was their primary phone, which can sometimes be the case. So you do want to make sure that you clarify with folks they're going to need to get their own plan. And though I thought I'd clarified that, I was apparently not clear enough. But we resolved the issue, and it went fine. Kevin, I want to piggyback off of something that you had mentioned with regard to costs. There are more costs than just what you're paying on the phone bill every month. When you have folks who drop their phone, obviously it's their work phone. So I think sometimes that the level of care that people give these doesn't tend to be as good as that which they might give their own phone. So there are costs involved in replacement, setup, the labor and time, setting it up, shipping costs. If you're sending it across the state and you need to overnight that, those things, they seem small, but they add up. And so, when I talk about costs, it wasn't strictly looking at phone bills and saying, oh, hey, this is a cheaper option. It's a better option all the way across the board. I don't have to have phone calls at 10 o'clock at night. Hey, my phone won't work. Okay, well, did you try to power it off and back on? Things like that. So this is nice in that respect. Just eliminated that.
Yeah, no, that's great to hear. And we've
Well, I should say I
we've heard
anticipate that
similar
it will.
feedback. Yeah.
Okay, good. Good.
Were you able to calculate any savings, any suspected savings as part of the program?
Yes. I anticipate if all goes well, we are set to save somewhere between $28,000 and $30,000 this next year, this next fiscal year.
Wow,
So,
that's great to hear.
and that is just based on cost. That's not the saved labor and all of that. So,
Kevin, what about you? How's the feedback been on your end?
We experienced the same thing. Now, we've been using it for 3 or 4 years. So we're in that phase where we've saved all the money we're going to save. Now it's just a new ongoing cost. Operating cost, it's not going to save you any money, or it'll be relatively the same. It's really where you save a lot of the money is if you provided phones to your staff. The purchase of a smartphone is costly. What are the new ones going for? $600-800?
Yeah.
So you save on that cost. You also, the labor for the IT side of things is pretty intensive. And like Paul said, they don't take care of their phones as well. We used to go through 5 or 6 chargers a week. Literally, people would lose them, the dog would eat them, whatever it is. They would drop them all the time. And typically it'll take, we use Verizon, which is not always the most user-friendly organization. Typically it'll take an IT person 4 hours, probably, maybe even 6, to get a phone in, set up, stay and hold for an hour, get passed to somebody else. So the money savings from that was huge for us, and we don't have to do that with a personal phone. So we saw a lot of savings, and some of it's not easily measurable, but you're going to have to do something like MultiLine anyway if you want to provide HIPAA compliance. MultiLine was very cost competitive, so the savings is really in your capital costs, your labor costs, and then a small operating savings.
That makes sense. Let's change gears a little bit. I want to talk about texting clients, patients, etc. This is something that I feel healthcare has been probably behind a lot of other industries in terms of embracing this as a mode of communication. Is this something that you all do with your firms? Is it something that you allow? Is it something you see a demand for?
We do.
Well, for ours, they're mostly, we deal with generally 21 and under clients. And I would say
that's all they do.
80% of what they do is texting, and our therapists who are 26 and 30, they do the same thing. They text. So it's critical to have a good texting solution, and MultiLine's great for it.
Yeah.
You have that what they call metadata if you need it, which is critical. You don't get that without a MultiLine type of app, which means you can, if you need to do the forensics, something happens and you need to kind of trace the information, see who read it, etc. That's what that metadata tells you.
Mm-hmm. Yeah, just to add on to that, yeah, all the texting within the MultiLine app is recorded, it's searchable, it's discoverable, so that's all there and very easy to access, which has been a huge help to a lot of our clients.
Yeah.
And soon, I'm told that in the state of Ohio, we may be able to bill for that, for text and email as well. So that could end up being very critical. But yeah, to what Kevin said, that is so true. Given the populations that we serve, especially with our school-based clientele, these folks are not financially well off. And from what I can remember with some folks that I used to work with at my former job, A lot of folks, they would neglect to pay their cell phone bill, but could still use Wi-Fi to send and receive texts. So it's just the best way for us to reach parents, and that's critical at times. So it just makes sense.
Yeah, no, and yeah, I agree with that. Now, do you see a world where a lot of your clinicians are going to be home for the foreseeable future, or will we get to a world where they'll be kind of maybe a few days in the office back and forth? What's your kind of long-term plan, if you had to guess?
Well, we're hoping that they go back. Face-to-face is always best. If you think about the kind of work that the folks at Kevin's company and ours do, it's people, and the best way to do that, to deliver that service, is face-to-face. But when you can't, you do the next best thing. As far as projections, it's just too hard to say. It's too hard to say at this time. This is a very fluid situation that we're in.
And have you found your clinicians are okay with that, and they're kind of going with the flow?
Some, well, I mean, nobody's had a choice in the matter. But
we've all had to embrace change.
We have, and I'll be honest, it's been a struggle for some. It really has. Some folks, we can do everything we can do on our end to provide the communication line, but you still have to have a willing participant on the other end. And, to remember that school-age kids are they had to do online schooling, so they were getting phone calls all day from teachers and having to spend time doing that. Parents are trying to work from home. They get burned out, and by the time the counselor rolls around, it's like, I'm done. I don't want to talk to anybody else. So I think that that's something. The adult population, they like face-to-face, and we found that the session times have decreased by about, in some cases, half the length. And I think it's just because nobody wants to sit there and hold a phone to their ear or in front of them for an hour. So
no, that's interesting. Yeah, because there are so many other outside, influences and events going on that probably distract from the attention. Whereas if you're in a room having that one-on-one conversation, that's where you are.
Yeah.
That's a good point. What about you, Kevin?
We've found it's the same thing. Maybe a third of our clients are very difficult to get a hold of for various reasons. A lot of it is they're just sharing, if they have Wi-Fi, they're sharing Wi-Fi with their parents, with their other siblings. School is demanding that they do things virtually. It's also a population that, and I think this is true of the future for us, is kids that are 28 or so, 30 years old and under. They are used to using smartphones, not laptops or iPads or whatever. And our software, the way therapists work, they're really used to using laptops, like Teams, et cetera. They're really made towards a laptop environment. So we have trouble doing that face-to-face over a smartphone, which I think is where the future's going. But it's a transition we're going to have to figure out, because I don't see within I think another year, like you said, Google's pushed their staff out for a year. I think the schools are going to find, I have a feeling come this month and next month, it's going to be very difficult. I won't call it a disaster, but it probably won't go very successfully. And everybody will push it out for a year while we figure out how to make this work. And I think behavioral health will be close to that. Another year before we get everything ironed out.
Are you seeing, it's funny you bring that up. Are you seeing a behavioral health kind of need uptick based on the pandemic? Like, have we hit that wave yet? I know I've read a lot of articles that say kind of right now, obviously we're dealing with the specific fallout from the actual virus, but then with the economy and everything else that's going on, we could have a real mental health crisis in the coming months and years. Is that something that we're seeing yet?
We aren't Paul may be. Our clientele is mostly Medicare, Medicaid.
Okay.
They referrals from schools primarily, or hospitals. And so as schools aren't open up, they're not opened, and you have the hospitals, which are back to kind of normal, but very restricted. And, if anybody's gone to the doctor, you sit in your car, they call you, very, so that our clientele is not well oriented or built to handle that. So no, we haven't seen it. That doesn't mean it won't happen, but it'll probably if it's going to happen, it'll be the next few months.
I would agree with that.
Yeah.
I would say our referrals, they typically drop off a bit during the summer anyway. But oddly, and though they still did, I still received referrals from both our adult population and our kids population, where we had established relationships and parents were eager to get services started. Life goes on. Trauma doesn't stop just because COVID's going on and we're not at school anymore. You just have fewer people who are able to identify the behavior issues because they aren't witnessing those firsthand. But they still exist. And if you have a parent who is in the know and understands that, it doesn't prevent that. I would say that I think the benefit to telehealth that we are experiencing is that where we may have had issues identifying a clinician, a mental health therapist in a particular area or locale, we can now pretty much go anywhere in the state of Ohio that we need to go. And again, while I would personally say that I don't feel as comfortable doing a non-face-to-face, especially with the young kids, I think this is what they're all used to. Even the young kids, they get their messaging from a video screen, a television screen. So I think this is the wave of the future. It's here.
No, that makes sense. Yeah, I think we're all being forced to figure it out on the fly. So, and they'll, some things will go backwards or sideways, and some things will go forward, and hopefully we'll end up in a better place. Yes. I do have a question from the audience that I would like to pass on to you guys. For those, we do have some people on the phone that operate in a more hospital setting, so this may be a bit different. But could you all share some of the communication changes that you've had to deal with? Obviously, we've talked a lot about the desire for younger patients to prefer texting. Any other big changes that you've seen in the past 6 months in terms of how clinicians are communicating with patients?
The materials are changing. Sorry, Kevin, I didn't want to rob your thunder if you had.
No, go ahead.
Play therapy is something that's huge with young kids, and our folks love to do that. But it's difficult when you don't have a sandbox that you can physically get into. And so they've had to learn new tools, new skill sets for that to be able to adapt to this new environment. So you have to think outside of the box on this. I think that's the only way to make it happen. The other thing I'd like to add too, with regard to texting, we get a release of information form signed for all minors, anyone that we're going to communicate with, third party, and they have a line item in there on electronic communications. So we make sure that that's marked as well and covers us. Even though we still maintain a policy of no transmitting PHI over text. It still helps us in that respect. Yeah. So,
are you using any of the redaction capabilities, Paul, within the tool to keep information that looks like PHI out of texting?
Currently, not that I'm aware of.
Okay. It is a possibility to consider.
Okay.
Kevin, what about you?
The
big changes in communications that you've seen?
I don't think so. I would say yes, but not. I'll give you a personal anecdote. When I used to go to the patient portal for my own physical health, if I would use their messaging, I could, and they have a little, send doctor a message. I can almost guarantee you 6 months ago, I'd never hear anything back. Nowadays, they actually respond. So, so some positives when I say this, and it's positive for the patient, that maybe the physicians hate it, I don't know. But so I've seen some positive in that patient portals are getting paid attention to. In my experience, they haven't been. But as far as behavioral health, it's most therapists have been taught to do an interaction face-to-face, and I think it's in their nature. That's why they became social workers. They're very caring and they want to help people. And a video conference is pretty cold and sterile. So I think that is it's a mindset that we have to change. That's not going to be different in the future, in that there won't be a lot of face-to-face as far as we can see. But I think industry-wide, ultimately, we want to go back the way it was. So I think when we can, we will. But we'll, where maybe 15% of interactions were done by remote, I suspect a third or more may be in the future. So this won't go away.
Yeah, no, it sounds like a lot of the same struggles that I think teachers in the education system are going through right now, where it's all, you have people that want to be face-to-face and it's all built around that model. And now, very quickly they're trying to figure out alternatives.
I think the ideal scenario is one that encompasses a hybrid of both, because you have, at least in the counseling world, we have days where kids are absent. We have summer breaks or Christmas breaks. And, it'd be nice to have that extra ability to reach out and check in with them periodically, but not have to do it full time electronically. Yeah. I think that would be helpful.
No, that's a good point. I'm work in the private sector and have worked in technology companies for a long time. I've been a remote worker for, I'll say, probably about the last 10 years. Now that came with a lot of travel, but it's interesting for me in that if I can get together and meet people I'm working with just once and have that face-to-face, then I can work with them remotely very efficiently from then on. And obviously it's great to see them, once every few months or whatnot. That's harder than it used to be right now. Yeah. But if it's someone that you haven't met in person, it's a totally different animal. It's much harder to do.
Yeah, I agree.
So let's talk innovation real quick. I know we're starting to run short on time, and for anyone listening, if you do have any questions, I'm monitoring the Q&A panel as well. But from an innovation standpoint, I know, Kevin, you mentioned the desire to hopefully evolve MultiLine into more of a video solution over time. Anything else out there that is a silver bullet that you think, wow, if we had this, it would really make a big difference? And it can be specific to MultiLine or not. Just, is there any technology that people are really craving for that either you don't have or it just doesn't exist yet?
That's a great question. I think the future of computers are laptop. If you notice, laptops are shrinking, and there isn't a whole much of a difference now between a tablet like an iPad and a laptop. But eventually, those will go to all become a smartphone / laptop. And so it's funny, when I grew up, software had a definition. You understood what it is. Now it's hard to explain the difference between an app and software, because essentially they are the same thing. One works on a smartphone and one works on a laptop. So I think the merging of that's going to be the future. Maybe a device that's smaller than an iPad but bigger than an iPhone will become what people use. Our younger staff will try to click on shortcuts on their laptop with their finger, and that gets them frustrated that they don't open up, or they have issues with mice, which baffled me, but it's because they're used to using a touch screen. And we also found, we recently did a training where our staff, I would tell them to capitalize. You're trying to type in a password and it has the first letters capital, and they would hit the caps lock key and they would start typing away, and of course it would error out. After 2 or 3 times, I realized they'd never been taught typing. They didn't know what the shift key was. So I explained what the shift key did, and then magically they could get into this software. So where I'm going with that is the future is going to be a sea change of it's the way our younger people are taught or not taught, and they're going to bring that to the work space, and then we're going to have to adapt to it.
I think that makes sense. What about you, Paul? Any innovations top of mind for you?
Not that I'm necessarily aware of. I will say that we, just prior to COVID, I would say back in February, adopted a mechanism for gathering electronic signatures, which really took the barrier of time out of the equation for gathering consents or any need for signed documents of any kind. And so we're very pleased with that. And like Kevin said, I think everything's going to end up going to the phone, what you can hold in your hands. It's amazing that technology that we hold in our hands, or most of us carry in our pockets, is greater than what put man on the moon.
It's true.
So,
and we take it for granted.
yes.
But it is true. All right, I do have a question from the audience, and this honestly, I'm reading this question, and it could be its own hour-long webinar. But the question is specific to with the virtualization that healthcare is going through right now and has been going through for some time. What do you think the impact will be on real estate holdings? And I think a lot of industries are dealing with this. How much office space do we really need? Obviously, with healthcare, you have office buildings, you have hospitals, you have, you name it. Any predictions for what you see happening there? Do you think we'll need as much space as we have? I know there are arguments out there that say less people will be coming in, but we need more space between the people. Therefore, we need all the space we have. Or there's obviously the other argument that says, well, maybe this isn't the best use of cost. What do you all think? What do you all see in the future? If you were commercial real estate developers, what would you do?
Good question.
I've been in meetings where that's already become a topic, which 3 months ago would never have been discussed, which is, do we need these buildings that are mainly just offices? I would say they're going to go away. The conference rooms, you'll still have conference rooms. I think those are in demand. But I definitely think office space is going away. Like you working at home, people enjoy it. It saves the organization money, and as long as you can be efficient at home, that's going to be an option for a lot of people.
And there's good and bad behind it. It's funny, I was just thinking about that. We traditionally haven't seen a lot of our clinical staff here at our office because they're spread out throughout Ohio, but we still have a pretty good core base in Cincinnati who meets regularly anyway. But I rarely see anybody come into the office now besides our very basic office staff. And I wonder about the impact though to these local restaurants and hotels who used to. I mean, we're in a primarily industrialized part of northern Cincinnati. We're in a northern suburb, and these folks have relied on heavy business travel to make ends meet, pay the bills. So it's going to be an interesting adjustment. I think we're going to see a lot of places closing as a result, and it's going to be different.
Yeah, no, I would agree. I think those are good points and certainly make a lot of sense. I did want to ask, this is sometimes a tough question, but given what you guys have had to go through the past few months rolling out these BYO programs, and I know you're on different timelines, but is there anything you could share with the audience that maybe you would have done differently if you look back on it? And I know that's a tough question to answer, but it's usually a telling one as well.
I would like to have done this a year ago. before we really had to push it. On the other hand, perhaps it's advantageous that we waited because folks were kind of expecting change anyway. So I don't know. I don't know if there was a good or a bad to it.
Kevin,
Yeah,
anything on your end?
I don't think so. I would have rather have done it sooner rather than later, meaning 5 years ago instead of 3 years ago, because it was so advantageous. There really isn't, I can't think of a negative to it. Well, one would be, and I'm going to use the iPhone because that's I'm more familiar with it than a Droid phone. But the one negative to any app is people like to use the native apps built into, let's say, the iPhone, which is that iPhone email icon, contacts, etc.
Yep.
And you do have to use you have to open up the app, whether it's MultiLine or any other, they're all the same, and you have to use their email ability, their email app capabilities inside that app. When the same thing with texting and importing your contacts, etc. It's all lives in that app, and that is a negative to them because they work differently, sometimes better, sometimes worse than the iPhone or Droid, which what you're used to. So that did take a little getting used to for staff.
Yeah.
It does cause some confusion.
Understood. That makes sense, and that's common feedback as well.
Yeah.
We did have one other question come in that sort of ties in the ROI conversation we had earlier, as well as the office space conversation we just had. So are any of you considering office space reduction as part of your longer term, cost savings efforts, and how does that tie into an investment in something like MultiLine or other communications tools?
I know that I'd never heard of the topic 3 months ago, and for us, our budgeting season is July through June 30th. So we won't really speak much of it, but next budget, which is next summer, I guarantee you it'll be one of the key topics.
Yeah.
As we transition to, we already have so in mental health, most of your therapists do work outside the office. So it's a little easier for us in that way, and that we already had a big chunk of our organization work outside the office. But yeah, I guarantee you it's going to be a topic for next budget year.
I would imagine the same will hold true with us. I don't even know that it'll wait that long, but I don't know. We've been here for a number of years, and we haven't really occupied a lot of space in terms of, we can see some clients here. I would say we probably see less than a dozen here physically in our offices, but I don't know. It's hard to say.
The one problem will be when everybody wants to get rid of their buildings, it's going to be hard to sell them. So
yeah,
easy in concept to say.
We're going to have to get very creative, that's for sure,
Exactly.
in terms of how we use all this space. And look, there are lots of use cases out there for using space, so hopefully we can do the right thing.
Yeah.
Yeah.
Well, I think we're running out of time. I did want to just finish with, is there any kind of advice that you can give to our attendees based on your experience over the past few months for things to look out for, things to take into consideration as they're potentially leaning a bit more on technology than they have in the past?
I would say just make sure you cross your T's and dot your I's. Make sure that what you're doing is HIPAA compliant, and take everything into consideration. But no, I really don't have any additional advice.
Yeah, I'd say the same thing as what Paul brought up. I would recommend you look at a lot of different products. Costs don't vary a whole lot, but there's a high and a low to each of the apps, and they're always pretty much a monthly cost that you have to pay per user. and then get the users to test it for you. And I've always found getting buy-in from the people that use it is critical, so that they can embrace it, because it's not going to work perfect. There's going to be issues with it. And when they've been the ones that help choose it, they tend to roll with the issues rather than be an obstacle to that rollout. So
Yep.
Get that buy-in.
That's a great point.
That is a great point. I think that's a good one to end on. Kevin Rinn and Paul Schmid, you guys, thank you so much for your time today, your candor, and I know these are interesting times, and we're learning as we go. But we really appreciate the conversation. We appreciate that you're great customers of Movius MultiLine. And for those of you on the call, you can see on the slide here, if you're interested in any more information, you can contact me directly, or Richard, who's on here as well, who's our healthcare expert. And we would be happy to talk more about our products and solutions. And other than that, I think I'm going to turn it back to Mark.
Great, thank you.
Close us out.
Thank you. So Kevin and Paul, thank you again for giving your time and your insights to everyone. It always is very beneficial to hear, what certain types of organizations are going through, and I think there's a lot of relevance in terms of applicability to the audience. So very appreciative of your coming on today, and Sean, thank you for facilitating a really interesting discussion today. So again, thank you all for your time and effort. Thank you for the attendees for coming out virtually, that is, and listening in. Just one final public service announcement here. There's another event on August 12th at 12 noon Eastern on augmented reality. That information will be sent out to the members, the New York HIMSS committee members, as well as being posted on the New York HIMSS website. So again, thank you, everyone. Have a great day.
Thank you.
Thanks all. Happy Monday.
And Mark,
Happy Monday.
thank you for helping as well.
Bye.
Bye now.